Definitely. A Disney statement noted.
All right, want to go back to Houston TransStar. Harris County Judge Lena Hidalgo is giving an update on the county's response to COVID-19. Let's listen in.
Houston Local Health Authority, Dr. Peirce, and Representative Wally, our recovery czar. Let me briefly just address the latest on the weather. We know that as Hannah tracks west tonight, we'll be expecting some rain chances, the threat of heavy rain, but we don't expect it to be severe. Of course, we must continue watching this. And it's a good reminder that we're in the middle of hurricane season, that we're vulnerable to these storms, and so we continue to ask everybody to make sure they have a plan, that they have a kit, and that they purchase flood insurance if they can. Remember, it takes 30 days to take effect. All that information is on readyharris.org, and we are watching the weather, these systems as they continue to track our way to make sure that we keep folks safe. Today, we are announcing 552 cases in Harris County outside the city of Houston and 5 deaths. Yesterday, our region reached another grim milestone. We crossed 60,000 cases across both Harris County and the city of Houston total. The good news is we've seen slight declines in hospitalizations, ICU and general population. They're very small, they're very slow, but they're there. The bad news is we've been seeing a huge increase in cases. Just in the past few weeks, we've continued to break records with the number of daily cases. The deaths these past few days, very high, but the 7-day average of cases is very high. It's 100 cases per day higher than it was on July 13th, for example, where we also have tens of thousands of active cases in the community. And that is all still a raging wildfire. We don't know what all of those cases are going to mean for future hospitalizations, and we have to keep watching. Over the last few weeks, I've heard from parents and teachers at a loss about what to do with school starting so soon. I've spoken to almost all the superintendents in Harris County. I've spoken with teachers and with parents and have heard a need for uniformity and a need for public health guidance. These superintendents have explained to me that they are educators, not medical doctors. With that in mind, our health department today, Dr. Shah, along with the City of Houston's Health Authority, Dr. Peirce, will issue an order requiring all public and non-religious private schools in Harris County remain closed to in-person instruction until at least September 8th. Now, that does not mean they can't start online instruction earlier, but I know a lot of the schools are moving their calendars. Let me be clear. This is at least until September 8th. More likely than not, September 8th is too soon, but we're going to aim for it. We'd love to meet that goal. It's very likely, though, that if trends continue as slow as they are, if cases continue to rise and that gives way to hospitalizations increasing, that we may not meet it. We will reassess this in the next few weeks. We'll be working on benchmarks and on thresholds based on best practices, based on what's worked in other places and other jurisdictions, not on what we wish would work. The start of on-campus instruction and activity may be delayed further based on those thresholds and based on monitoring of the metrics that we see. So the idea is to give some clarity, to give some consistency, but really we need to work on thresholds and not on dates. I owe everything in my life to public schools. When I showed up to an amazing public school, that showed me what government could do. My counselors and my teachers set me on the path that I am here today. The last thing I want to do is shut down a brick and mortar representation of the American dream. But right now, we're guided by human life, which has been our North Star, and we have to make tough decisions. The most important point to get across today is that each of us in this community have the power to bring these kids back to school. That's squarely in our hands. What I've been asking for folks to stay home is what we need to do to bring the kids back to school sooner. The reason other communities have been able to start school, yes, they also had Memorial Day, and they also had protests, just as we did. But they brought down their curve back in April and in May. They didn't give up early. We can't afford to give up early again. So let's continue working until we crush that curve. We bring this under control. We bring down that community spread. And then we can responsibly bring our kids back to in-person schooling. I'm not going to raise false hopes. In part, that's what's got us to where we are in this moment, tragically. Even if we do meet benchmarks that tell us it's safe to resume in-person instruction, it's not going to be all students back all at once. We're going to have to work on processes. That may mean some students go for a few days. It may mean some populations go in first. We have to work with the reality of the situation, not false hopes, not what we hope will take place. I want to thank all the school districts who've taken action already to delay in-person instruction. Right now, we continue to see severe and uncontrolled spread of the virus, and it would be self-defeating to reopen schools as usual for in-person instruction. Almost 1 million students from grades K through 12 in Harris County. We are all desperate to move on from this crisis, but I want to remind everybody, the faster we work together, the faster we bring this virus under control, and that means crushing the curve. It does not mean flattening it at an extremely high level where our ICUs are still crossing into surge capacity, where we have tens of thousands of active cases. It means bringing down those numbers. The faster we do that, the sooner we'll be in a position to reopen again for the long term, and I hope that the religiously affiliated schools will follow suit to help us bring that curve down faster and ensure that our kids can go to school in person where they belong and where they deserve to be. Our children's education and their ability to succeed, to continue thriving, is in our hands and has been in our hands. So it's time for us to work together and get this under control. Thank you so much. I will give the podium to Mayor Turner, and then we'll hear from Dr. Shaw, Dr. Peirce, Representative Wally, and then I'll repeat my remarks in Spanish. Mayor Turner, thank you. Excuse me.
Thanks, Judge. Thanks, Judge, and I certainly want to thank you for your leadership. And State Representative Amanda Wally, good to be with him, the Chief Recovery Officer for the Harris County, Dr. Peirce, Dr. Shaw. It's good to be with all of you. Over the past several days, my office has received phone calls and emails from parents and teachers, and I have consulted with superintendents about opening schools during the current public health crisis. Houston Independent School District is the state's largest school district with 288 schools, 13,000 teachers, and more than 210,000 students. My office worked with a total of 17 school districts within the city of Houston, and we also collaborate with Region 4, which includes 48 districts. Let me just say that the COVID-19 positivity rate and hospitalizations are at an unacceptable level. We should not be very careful about talking about sending our children, teachers, and staff back for in-person instruction when the virus is still spreading uncontrollably within our community. Yesterday, for example, the city of Houston Health Department reported 919 cases and 11 deaths. And overall, 357 people.
We're AAA family.
Virus in the city of Houston, Harris County, is not under control and is spreading rapidly still within our city. I want to give some context to what we are saying today and why the action is being taken. If we go back, for example, in the city of Houston alone, in March, the total number of positive cases was 377. In May, that number was 3,793. In June, that number, and for the month of June, was 12,885. And as of today, and we have new numbers that will be coming out later on this afternoon, but as of today, in the month of July, that number is 19,139. So when you look at each month coming from March to where we are, the number of positivity cases just inside the city of Houston has exponentially increased. And it has really taken off since we opened up our economy. And so for June and July, these numbers reflect an uncontrolled virus taking place in the city of Houston. With regards to the number of deaths within our city, in March, for the entire month of March, that number was 4. In April, the number was 52. In May, the total number of deaths went up to 73. In June, the number was 95. And as of now, in July, just for the month of July, the total number of deaths in our city is 133. And so as you can see, the number of deaths every month is exponentially rising. Context. It is very difficult to talk about returning our kids to school in the month of August. We all have a stake in this process. Education is vitally important. The pandemic disrupted our normal routines when schools closed early and districts shifted to online learning. We do not want children to fall behind. No one wants our kids to fall behind. We want students at all levels to get the knowledge and skills they need to succeed. And in some cases, we also know they miss seeing their friends and teachers in person. But we must keep them safe, our teachers safe, janitors, bus drivers, cafeteria workers, and so many, many others. And that is why it is important that we move based on the science, the facts, what's happening on the ground, and we do it in a very measured and methodical fashion. Saving lives and slowing the virus from spreading are the city of Houston's top priority. And we can do that by delaying in-person, face-to-face instruction at a minimum until September the 8th. We are at a critical moment in the fight against COVID-19, and we must take a step back and work to lower the positivity rate and hospitalizations. I want to echo something that the judge said. The positivity rate within the city of Houston and Harris County varies anywhere between, let's say, 20, 22, sometimes 23%. And even though there is some modest, minor decrease in terms of the number of people going to our hospitals, and even though it appears, even in our ICU capacity, there's been some degree of slowing down, it is happening at a very high level, much higher than existed in April and May. And in order for us to have some degree of confidence and for our testing and contact tracing program to be effective, that positivity rate must be driven down. Not to 20%, not to 15%, not 10%, but quite frankly, it needs to be much lower than that. In New York, it's 5% or below. In Boston, it's below 5%. And that is why they're able to move forward in a very measured way with the greatest degree of safety for all concerned. In a few weeks, we can look again at the data and see where things are and reassess. But I want to make it very, very clear. Even, for example, if the governor in the state does not return a stay-home order, it is important for the people within our city and the people within our region to assume and take the responsibility to do the things that we know work. And what we do know about this virus is that it feeds on one another. It feeds on close contact, socialization, group gatherings. It feeds on that. And in order for us to be successful, we have to take the energy and the fuel away from this virus. And the quicker we do that, the quicker we're going to be able to take those steps to move forward. Now, quite frankly, and I'll leave it to Dr. Peirce and Dr. Shaw and to our medical community, quite frankly, I don't know if just wearing a mask and engaging in social distancing and the proper hygiene is going to be enough to lower that positivity rate in time to do the things that we need to do. Now, yes, we are, in a sense, plateauing at a very high level. But the question is, just with the tools that we are employing today, how soon will it be for those tools that we are just employing today to bring that positivity rate down to where people will feel comfortable and where our contact tracing and testing protocols will be most efficient and most impactful? So let me just say, our kids are our greatest assets. And the teachers and the cafeteria workers and the bus drivers and the janitors, these are vital, essential people who are needed to service our kids. And I think it's very important for us to do everything we can to put them in the safest environment in order to make sure that we are not using them in this experiment. Thank you. Dr. Shaw.
Thank you, Mayor. Thank you, Judge, Mayor, Judge, for your continued leadership. I want to also thank Representative Wally as well as Dr. Peirce, my colleague here. My name is Dr. Umair Shah. I'm the Executive Director and Local Health Authority for Harris County. And I want to really echo what you have just heard. We know that kids are precious to all of us. And our school-age kids particularly are going through a very difficult time right now. We know that time is really because a lot of them are essentially staying home. And they're not seeing life like all of us as adults have seen. All of us have been impacted, yet we remember our childhood, and our childhood is not what our kids are seeing now. And I'm saying this not just as a local health authority, as a physician, I'm saying this as a father. Father of 3 children, 2 that are school-age children. And I'm telling you that every single day, my wife and I are having this discussion about what's happening with our children. What are we going to do? What's going to happen? And how is this pandemic affecting them? And I know there are so many parents out there that are having the same discussions every morning, every afternoon, every evening, every night. They're having it with themselves. They're having it with their neighbors. They're having it with their school, whether it's the superintendents, teachers, faculty. They're having it with everyone involved, but most importantly, they're having those discussions with their kids. And I think we have to remember, and the judge and the mayor just said this, and I want to echo, when you have transmission that is high in our community, it's uncontrolled in our community for COVID-19, and you're seeing increases in cases and also deaths that are occurring, this is not the time that we take the 900,000 plus students in Harris County and say, go back to school in person because it's okay, because it's safe. It is not safe. And that is the reason that Dr. Peirce and I are signing this local health authority order today, because we want to make sure to emphasize that it's not just about protecting our children because they are the most precious resource for us, but it's also remembering that those very children are dependent on all of us as adults, as parents, as community members, to make sure that we do the right things, we model those behaviors that are going to allow them to have the same experiences that all of us had when we were children by being able to go back to school in person. This is going to be a difficult process. You've just heard about the numbers. You've heard about the positivity rate. You've heard about the concerns. What you haven't heard is that all of us continue to recognize that we want just as much as everybody to have our kids back in school in person as quickly as possible. But it's just not safe to do so right now. So I wanted to also mention that with the positivity rate and with the increase in cases throughout the community, I want the community to remember this is with 900,000 children, students that are not at school. If you can put it in perspective, all this time that we've been doing all of these activities and actions and taking all the steps that we've taken, what could or would that positivity rate been, or what could or would the number of cases been, or what could or would the hospitalization numbers be if almost 1 million kids were actually not home but in schools? And that is another reason that we are very concerned about what's happening. I want to thank our schools. I want to echo what Judge and Mayor just said. Our schools, our superintendents, our teachers, our parents, we have received so much feedback. We have met virtually with so many, and we have heard you. We know that this is important. This is one of the most important decisions that all of us are challenged by in the midst of this pandemic. But it is not safe now for us to have our children to go back to school. Let me shift for just a moment to the medical perspective. I know the judge mentioned this and the mayor echoed this as well, that while September 8th is the date that we have put into health authority order, it was a very careful, deliberative process in getting there. And the judge and the mayor said it very nicely, and I just want to repeat this, that we, Dr. Peirce, myself, our respective teams, along with our county and city leadership, we're going to continue to watch all those indicators, all those measures. And it's not just one indicator, it's not just one measure, it's everything together. We're going to watch those over the next several weeks. And again, it's up to all of us as adults to help make this a situation where our kids can come back sooner to in-person instruction. We've also heard that people say, well, children don't get COVID-19. We also hear that children don't have severe disease from COVID-19, and we also hear that children, some say, may not be able to spread COVID-19 as readily. And that's not true. Kids can get COVID-19. Kids can have worsening conditions. In fact, there is a condition called multi-inflammatory syndrome that is a very concerning condition. We've had cases, 186 cases across the U.S. We've had a handful of cases here in our community. In addition to that, we also know that kids can spread COVID-19 even if they have mild symptoms or no symptoms. They can spread it to their teachers, they can spread it to other people at the school, and they can certainly come home and spread it to their parents, their grandparents, and those with underlying health conditions. That's why it's so important for us to remember that kids also can be affected by COVID-19. Let me also say that every community is going to have a different set of challenges, and so I would caution us not to look across the country or across the state and say, what are other communities doing and why are we doing this way? We have to remember that we are making the best decisions from a public health standpoint here in our community. And we are completely 100% focused on making sure that our community is safe, healthy, and ultimately protected. Let me close by saying, if we want our schools to reopen quicker in person, it's going to take all of us to pull together in order to be able to do that. Thank you, and I'm looking forward to some additional questions. Dr. Peirce.
Thank you, Mayor, Judge Hidalgo, Dr. Shaw, Representative Wally. So Dr. Shaw has said pretty much everything. I just want to put in context to keep in mind something he touched on, and it's, while we focus a lot on the children and the students, and we talk about the faculty and the staff at the schools being at risk, let us not forget the families that the children will bring the virus home to and their elder family members, all right? So anecdotally, so today I'm the physician on call for the Houston Fire Department. I have somebody covering my call right now. We do this press conference. But this morning between 7 and 9 a.m., I helped manage 2 cardiac arrests, 2 CPR cases. In both of those cases, the people had been recently diagnosed with COVID disease, and I don't expect that either of those, unfortunately, were going to survive. The firefighters and the paramedics did everything they could, but as they were going to the hospital, the outlook was pretty dismal at that point. Both those people were awake at some point this morning and collapsed at home with their families. In the second case, the report that I got was that every member of the family in that household had been recently diagnosed with COVID disease. So the last thing that we want to do, and we all know, now my daughter is no longer at home. She's just grown and out of the house, but I clearly remember what would happen because I'm a bit of a rhinovirus magnet. So every year I would get the cold. In fact, I routinely get the cold twice a year. It's just the way I'm put together. But I knew that once school started, that I needed to beef up my hand washing and be careful what I touch, and invariably that failed. And I would catch a cold, and I get it twice a year. I get one shortly after school would start, and I get another one generally in January or February. And it's not the kids' fault. This is what kids do. They go to school, they hang out with their friends, they laugh, they talk loud, they do all the things that the virus takes advantage of to spread. And the kids, thank God, don't get terribly sick for the most part. Some will, and as Dr. Shaw points out, the denominator we're talking about is a huge number. And so even a tiny percentage of a huge number is still a big number. And if they then bring the virus home, well, first of all, a small number of a small person, a big number is still a big number. So if those kids, if we get a big number of kids who get seriously ill, I think we need to recognize that is all preventable. Is all preventable. And for those kids who bring it home and spread to their family members, those infections are preventable as well. So when I say that, I don't want us to focus too much on just what we're doing with the schools, is the prevention. The closing the schools really is a strategy to buy us yet even more time for us as a community to get the virus under control. So if we want the schools to start opening up again on September the 8th, we as a community have between now and then to get the numbers down. And while some of the numbers that we're hearing from some of the folks in the medical community might be a little bit encouraging, please do not overinterpret what that means. I've been using the analogy, and I particularly use the analogy, this is a school bus because we're talking about schools. So this school bus right now is no longer accelerating, or it appears at least to not be accelerating. Maybe it's not accelerating, and maybe it is in certain, and in fact I'm sure that it is in certain parts of the community. It is still accelerating because we're still getting really high new case numbers. So depending on how you look at it, you may think it's not accelerating, maybe not. But either way, it doesn't matter because this school bus is going 100 miles an hour and we've got a curve ahead. So as a community, we have got to slow this down, and we've got to slow it down a lot. So at some point in the future here, I think the numbers will start looking better. And we will really have confidence that the numbers really are starting to look better. That should happen in the coming weeks if we all do our part. But once that begins to happen, that is not the time to stop our efforts. So if you look back in March and April, we had some very low numbers. Now let's remember that there was a statewide lockdown at that point, and that's what it took. We don't have that lockdown anymore, which means that as individuals, we've got to redouble our efforts to make sure we're wearing masks. If you see somebody not wearing a mask, don't go near them, and if you know them well enough, you may want to ask them to put on a mask. And if you know people that are having a gathering, a social gathering, you may want to ask them not to do that. Because those are the types of behaviors that the virus takes advantage of. And as long as the virus is spreading through our community, we're at risk, the kids are at risk, the economy is at risk. We have control over this. We have limited options, as the mayor points out. We only have limited options right now. So that means we have to maximize those tools in order to be successful. Thank you. Representative Long.
Thank you, Judge Hidalgo, Dr. Shaw, Mayor Turner, Dr. Peirce. Look, I stand here as obviously a member of the Texas legislature, having to deal with schools on a yearly and almost daily basis, but also as a father of school-age children. One is Armandito, he is 10 years old, and Joaquin is 6 years old. They're both about to enter first and fourth grade. And believe me, I understand the anxiety that parents have in trying to plan a safe way to transition into school. So I'm here as a parent as well. I'm also here as somebody who grew up with their grandparents, Dr. Peirce, to a single mom living with both my grandparents. And so, and I know there's my story is emblematic of many stories in our communities where we live in multi-generational families in one household, where you have grandparents, you have parents, and you have children, and sometimes extended family that live with you in the same household. So this measure is a measured approach, is a measure that is well thought out so that we don't have this community spread. Now look, we all want children to go back to school as fast as they can. Believe me, I want my children to go back to school as fast as anybody else wants them to do as well. But at this point, knowing what we know at this point, it's probably not safe to do that at this point. Lastly, TEA about a week ago announced going to propose $200 million in digital divide devices. I would say to Commissioner Murad, to the state leadership, thank you. We appreciate those resources. It's not enough. We need more resources, more investment from the state to provide devices and connectivity, because you have many children in this community that are going to be left out with maybe no device, or have one device but not have connectivity, or vice versa. If you do have a device and you do have connectivity, you have multiple children in that household. So I would say my parting point would be that we need more investment from the state to provide devices and connectivity for children that do not have access to the devices and activity to do the virtual learning that we're asking them to do up until September 8th. So again, thank you for that investment. We hope that that's a down payment because we have probably over close to $500 to $600 million. Digital divide costs money. There's probably $500 to $600 million in need, Mayor, Judge, in bridging that digital divide for many children. Many children. And many of those children are low-income children in our communities. So I'm talking to those parents. I'm imploring those parents to reach out to our state leadership to make sure that we put pressure on our state leadership to put more investment into bridging this digital divide, because the resources are there. The state has resources, has CARES Act money as we speak. And so I implore them. Thank you for the first $200 million. We need another $200 or $300 more million to bridge that digital divide for these children that will be virtual up until September 8th, which is the recommendation. Thank you, Judge. Thank you, Dr. Jal. Thank you, Mayor. Dr. First.
Thank you so much, Representative Wally. Let me just briefly repeat the remarks in Spanish, and then we'll take questions. El día de hoy
You've been listening to Harris County Judge Lina Hidalgo, Houston Mayor Sylvester Turner, and other local health officials talking about the signing of a local health authority by both Dr. Umair Shah of Harris County Public Health and Dr. David Purse with the City of Houston Health Department. That local health authority says that all public schools and non-religious private schools in Harris County will remain closed until at least September the 8th. The judge saying at least September the 8th, making it a point saying that this closure could go beyond that for in-person learning instruction. And most likely it will have to, given the number of cases of the virus that we are seeing across Harris County right now. She says she is not in a position to make false hopes at this point. She's been talking to superintendents from school districts all across the county. Lisa.
Yes, and she said in regard to that September 8th date that she didn't want to create that false hope. She can't afford to give up early. She talked about the total number of cases, Houston and Harris County, the total sitting around 60,000 COVID-19 confirmed cases. She did say she's happy to see that slight decline in hospitalizations, but there's that still huge increase in cases. They are continuing to break records, so that's a great concern right now. Tens of thousands of active cases, and she did call it a raging wildfire.
Yeah, we have been closely monitoring ICU hospitalizations for the Texas Medical Center group of hospitals. As of now, those numbers have jumped to nearly 108% capacity, which is a new high there. Half of those beds are filled with COVID-19 patients. However, new coronavirus cases in the ICU have slowed over the past 7 days, so a glimmer of hope there as we continue to battle this virus on several fronts across our area.
Should point out, we don't believe there were any Harris County districts in that jurisdiction who are planning to go to start the semester off in person, but it's just the general rule she's putting out so that districts can't, change their mind. Not that I think they would, because the numbers are still so scary at this point.
Yeah, HISD not planning in-person instruction until October the 19th, I believe. Right. I know virtual remote online learning for HISD scheduled to start September the 8th. Our education team has been in touch with many school districts, many superintendents of school districts all across the Houston area, and they are fully well aware of the risks of sending students back into a classroom. One of the things that's been noted from several of the school districts that when the time does come to start that face-to-face in-person instruction, not all of the students and teachers are all going to come flooding back to a particular campus at once. That's never been the plan from the get-go. Right. I know we heard County Judge Lina Hidalgo talk about that. That's not something that's ever been discussed. According to the reporting that we've done, what the plan is, the long-term plan, and I know some school districts have already talked about this, is to have staggered schedules for students and teachers so that not everybody is back in a particular school at once.
Yeah. I think speaking for myself anyway, as a parent, you can appreciate the words of Dr. Shaw, Representative Wally, talking about, their dads, they have kids, school-age kids who are just they want to go to in-person. They want to be there in person. It's just not a safe time right now. Dr. Peirce said, hey, don't forget the families are also at risk. Sending kids on campus right now, then they come home, potentially transmit that to their families. He said this is a school bus going 100 miles an hour right now, so we have to be very, very careful how we handle going
And
forward.
certainly very telling the way he put that. That's certainly going to grab the attention of parents all across our area. We're talking about some 900,000 plus students in Harris County, so certainly these plans that are being rolled out by districts, there are a lot of moving parts to them. They're complicated, and every T has to be crossed and every I has to be dotted when you're talking about the health and safety of not just the students, but the faculty, the staff, the bus drivers, as you and I were talking about earlier, bus drivers having concerns about, being around students or maybe having too many students on a bus who aren't able to socially distance. So these plans, we've heard from several superintendents and they all acknowledged, hey, look, we know we have to be flexible given the state that we're in. Harris County still currently under a level red. Folks strongly encouraged to stay at home, work from home. Things could change at a moment's notice in terms of these plans that have already been laid out, that have already been rolled out by the districts. And adjustments will likely be made and have to be made moving forward in the next few weeks.
Such a frustrating time for parents and children alike. I mean, you have parents who have to go to work, are able to go back to work, and now they're saying, well, my child's at home learning virtually. How do I go make a living for that child, for my family, when I have no child care? That school was my child care, and now what do we do? And I hear from parents like that all the time. That's frightening, because you're talking about how are they going to pay their bills, pay their mortgage or the rent. It's a difficult time.
And as we've reported over the past few days, one of the things for parents in Fort Bend ISD, which is obviously separate from what we're talking about, Fort Bend ISD intends to roll out learning centers. There are also private learning academies all across the Houston area. One in particular, Kids Are Kids of Lake Conroe, is a place that we profiled earlier this week. But that's just one of the learning academies. There are Kids Are Kids academies all over the Houston area, including what they've set up are education pods specifically for those working parents that you were talking about. These are, parents, like you said, they got to go out, they got to make a living, they have to pay the bills. They can't monitor their child's remote online distance learning from home. So these education pods will serve as places for their kids to bring the curriculum from their particular school